everyone, my name is Eamonn. I'm the General Manager for Geospatial Services, Data Governance and Quality with the Ordnance Survey of Ireland. The presentation today was going to cover how the Ordnance Survey of Ireland, which is the National Mapping Agency of Ireland, worked collaboratively with partners at a time of national emergency to leverage OSI's authoritative geospatial data, the data governance capabilities and the state's geospatial hub, GeoHive, to support Ireland's response to the national COVID-19 pandemic. So back in December 2018, the Government of Ireland published its first public service data strategy, highlighting GeoHive as the state's national geospatial data hub, which provides a ready-made, proven, highly versatile platform for sharing geospatial and statistical data in Ireland using the latest technology. At this time, OSI also published its 3-year strategy, which had a strong focus on data governance and quality, with a clear mission to provide trusted authoritative geospatial services through collaboration and partnership. Over recent years, OSI have made significant investments in creating GeoHive as the national geospatial infrastructure for Ireland, implementing strong data governance practices using the data management framework DAMA. So this meant when the threat of the global pandemic began to emerge, OSI had the technology platform, the partnerships and the processes already in place to support the government's response in the looming national emergency. In parallel, OSI had already a strong working relationship with the Ireland's Central Statistics Office, the CSO, underpinned by an official memorandum of understanding. And we've been working together for a number of years to build Ireland's Sustainable Development Goals, the SDG data hub, to monitor the progress towards achieving UN's SDGs in Ireland. As a result of this ongoing initiative, the two organisations had a proven experience of working collaboratively together and had the right processes in place to ensure efficient and effective data governance. So in January 2020, no one could have foreseen how quickly COVID-19 would spread and the devastating impact it would have on lives around the world. No one could have anticipated the lockdown and other unprecedented measures the Irish government would need to introduce urgently to save lives in Ireland. From the very outset of the crisis, the Taoiseach's office, the Ireland Prime Minister, senior medical officials, national public health emergency teams and local authorities were all asking the same question. How many cases of COVID-19 were there in Ireland? And more critically, where were they? Everyone needed answers quickly because of huge decisions that needed to be made around introducing lockdowns, closing of businesses, and the preparation of healthcare organisations for the possible surge in patient numbers. Therefore, it was clear from the very beginning that statistical and geospatial data would play a critical role in the national response to COVID-19. OSI was able to respond rapidly to the emerging crisis because of the work we've done around Sustainable Development Goals. So we were able to refocus to people, processes and technologies to respond to COVID-19. When the COVID-19 began to emerge as a very real threat to life in Ireland, the SDG group refocused its efforts to the pandemic. We also extended the group to include other organisations such as the All Ireland Research Observatory, based in Maynooth University, for data handling and spatial analysis. We also included our parent department, Department of Housing, Planning and Local Government, as a key player in the management of all local authorities. The new group was called the GeoHive COVID-19 Response Coordination Group. It was set up within days with a vision to provide key data and tools to inform Ireland's operational intelligence and situational awareness efforts in the response to the COVID-19 outbreak. The collaboration between public and private sector organisations led by ourselves, the group had formally defined purpose and was guided by the mantra of collect once, use many times. It wanted to ensure that all data pertinent to the health crisis was collected once and shared effectively through GeoHive. So the different government agencies, departments, in response to the government to the crisis, wouldn't waste time and resources duplicating effort in the collection, data management and analysis. Over the intervening 7 months, the group developed data, infrastructure, processes, and a number of public, private, secure data hubs, geostatistical data governance subgroups, and technical architecture advisory groups. We also delivered a number of initiatives, which I'll cover in the next few slides. The data ecosystem and the data governance were key to underpinning the national response. The Central Statistics Office took multiple data sources into their administrative data center and providing it as anonymized statistical data for publication through GeoHive. We also took a data feed for the National Pandemic Modelling Team and the epidemiologists through GeoHive. This allowed us to create dashboards, reports, and analysis for both public and internal use. In terms of public dashboards, the GeoHive COVID-19 Response Coordination Group hit the ground running and created a public-facing dashboard. This dashboard allowed public users to view the statistical information both graphically and as tabular information. This data source also provided data feeds to our national media outlets such as RTE and also through the COVID tracker app that was launched by the government. During the period of March to June, we had over 750,000 hits on the public-facing dashboard. In parallel to the public-facing dashboard, we also created a secure data hub for the National Public Health Emergency Team. This more extensive dashboard provided over 100 key healthcare workers, the CMO's office, with daily updates on a wide range of key indicators, including the capacity of intensive care units throughout the country, the number of ventilators, and critically, a national view of the number of COVID cases within those intensive care units. Over time, the Department of Health decided to release more data to be available to the general public, and the dashboard that we originally created needed to be extended to handle the larger volumes of data. So we created a public-facing data hub. This data hub allowed users to explore more data in greater detail. This data hub had the cumulative number of cases, death rates on a geography basis. The general public could then see hotspots of where there was outbreaks in nursing homes, factories, and local areas to allow them to make more informed decisions around their own public health safety. This dashboard currently gets about 500,000 hits per day. Another initiative we've created was for our parent department and the local authorities. So through the lockdown, the local authorities in Ireland were responsible for engaging with volunteer organisations to coordinate support in the community, particularly around vulnerable individuals who were self-isolating or cocooning. Once again, we used the platform to record the number of calls to the local authorities with regards to the number of meals delivered and the number of calls to socially isolated members of the public. This dashboard again was updated daily and was used throughout the entire lockdown process. When the Taoiseach's office started planning for the reopening of the economy, the GeoHive Response Group created a report and a dashboard showing the locations of retail units, their types, sizes, and number of employees. The group was able to deliver a more detailed intelligence report to government officials in a short timescale. This report helps the Taoiseach's office in deciding to open retail businesses earlier than planned. There are many other examples of dashboards and reports that the COVID-19 response group have created. One project was to create a data hub showing the average footpath widths to help town planners and local authorities identify social distancing measures that would be hard to apply, particularly around busy retail locations. We also included within the hub the location of bus stops and retail units to identify potential pinch points for pedestrians. Another project the group worked on was a dashboard for An Garda Síochána, the Irish policing service, to help monitor traffic, mobility and the movement of people throughout the lockdown period. This application was used to identify areas where individuals were moving at greater detail to allow for the allocation of resources for those areas. In each of these cases, the data behind the dashboard was provided as open data services. So any user could request the data in multiple data formats. We also provided the data as machine readable linked data. This allowed other organizations to take feeds, create their own applications, their own websites, but all reading from the same authoritative data source. When we look back in the coming months, there will undoubtedly be many lessons learned with our experience around COVID-19. However, we can already appreciate the key role that geospatial data and applications have played in keeping people informed in this fast-changing situation. In many respects, this healthcare crisis has validated the investment in GeoHive, proving to OSI, government and our partners that it is indeed the authoritative, standardised public sector data collaboration platform that is needed for the country. Some of the next steps we have planned included a continued support for government decision makers. We will continue to extend the data, the visualization tools that we have. And looking ahead, Ireland is now a proven platform, a well-established data governance process, and a strong working partnership as part of the national response to COVID-19. Whatever challenges Ireland and our government face, the geostatistical community in Ireland was ready when it mattered. We will continue to support our journey to fight against the COVID-19 pandemic. Thank you very much for listening.